Thanks everyone for joining. This is, I'm sure you've been to a few of these sessions. So this is a session about the evaluation of the Leeds Mindful Employer work. And I won't talk too much about the results at all. I'll touch on them, but this is much more a sort of insight into how do you actually approach evaluating a network, something that's so complex and infiltrates into so many areas of Leeds. So it's going to be more that perspective, and I'm hoping we can have a bit of a discussion at some points as well. I'd be really interested to hear your experience in that area. Donna, do you want to introduce yourself?
Yes, I'm happy to do that. I'm Donna Whitelock. I am an advanced health improvement specialist within the public mental health team, and from a commissioning point of view, I commission the Leeds Mind and Lee, who wonderfully delivers on the Mindful Employer Network for us, and I've worked quite closely with the PHIRST team on the evaluation of the network, which has been, from our perspective, a really beneficial piece of work to help us looking at securing the funding and the procurement for this network for the next foreseeable future, hopefully the next 10 years or so. So yeah, it's been a valuable piece of work. I'm happy to catch up with anybody outside of this meeting as well who might want any further advice around kind of networks, what we've done in Leeds, how we've gone around the commissioning side of things. So please reach out if you do need anything.
I'm Sarah. I'm part of a research team in Edinburgh. The research team is called PHIRST Elevate, so with a PH, not the number first. And my job title is knowledge broker, so I make sure that the insights we gain from these evaluations, whether that's the knowledge that each evaluation gives us or whether that's the methods about the evaluation, I basically ensure that has an impact. And today will be a bit more about the methods, but we'll also touch upon the findings. And as we've kind of I've hinted at today, we talk about a mental health network in Leeds, so the Leeds Mindful Employer Network, and how we evaluated it. So, you can see the people involved in each of those different components. So the network is commissioned by Leeds City Council, run by Leeds Mind, and uses the Mindful Employer, the chart and the branding. And it's us at the University of Edinburgh who evaluated it. So I'm sure everyone here in this room knows a lot about mental health in the workplace, but just a little kind of guess here, what percentage of sickness absence do you reckon is due to mental health difficulty? It's about 10% of sickness absence is due to mental health difficulty, and this is in Leeds now. Another quick guess, what percent? How much do you reckon mental health costs in Leeds throughout the year? And that's mainly due to lost economic output and benefit payments. How much do you reckon is that number? It's in the millions, if that's any use. About 500 million. So it's a pretty big chunk of the economy that is affected by workplace mental health. And I don't know, Donna, are you the one who put this together, this infographic?
Yeah, so we did this infographic. Yeah. We don't have a lot of really local evidence base around employee sickness in Leeds, apart from the stat that Sarah's just shared there, around 500 million. But this is an infographic I pulled together based on the evidence base nationally. And I think a couple of the striking things from this is that 1 in 6 people 1 in 6 employees in the UK experience a mental health difficulty, but only 1 in 5 people feel that they're able to discuss mental health at work. So I think there's still this quite big stigma between feeling that you can discuss mental illness within the workplace. And obviously that results in quite a lot what we know in terms of like presenteeism, which is working when people are unwell. We know that has like a cost of around 24 billion to the UK each year, and an additional 42 billion is the annual cost for mental health related absence. Some of these stats are a little bit old, but they are kind of the latest evidence base that we do have. And I would recommend a really good report from Farmer and Stevenson on thriving at work. which is a really good a report that looks at mental ill health across the workforce and breaks it down into certain kind of sectors.
Thanks, Donna. So this is sort of the backdrop that we're working with. And this is also where the Leeds Mindful Employer Network comes in, which tries to really address some of those key issues that Donna just outlined. In a nutshell, it's a network commissioned by Leeds City Council, run by Leeds Mind, in partnership with a steering group of employers. And it really provides an infrastructure to support employers to improve mental health at work. And it does that through lots of different ways. I've put some up here. So I think cornerstone is really newsletters and events, and only you do one-to-one consultancy as well. Tools and resources. There's a conference that had just happened in May, and it's really about promoting peer learning, about promoting lived experience and real-world examples, and lots of leadership development signposting. Lee, is there anything you want to add?
No, I think that's correct. I think it's all about sharing best practice as well, and it's about being that bridge between sort of public health interventions, sort of third sector wellbeing interventions, all the things that, and the clinical interventions that are available in the city, as well as the sort of more informal community-based interventions that employers can promote to their employees. I think we sit really well in the city to be a one-stop shop for all that information. I think we did get described as that, as a place where people can find all the information they need for their employees through our sort of communications. And we try and help employers to promote campaigns in a meaningful and non-tokenistic way as well. I think that's another big part of the work that we do for the people in the network.
And lots of members, I think over 800, and across, like you said, Lee, just across all organisations, all sorts of sizes, different sectors, totally different workforces. So really good span across Leeds. Good. And so this network was evaluated by the University of Edinburgh. It's through a very specific scheme called the Public Health Intervention Responsive Studies Teams. It's NHR funded, so it was evaluated at no cost to Leeds City Council. What Leeds did is that they applied to the scheme an expression of interest. It's about 1 or 2 pages, I think. That goes to NIHR. There's a selection process, so it is competitive. But if you get through that, you get allocated a research team who does the evaluation. In this case, it was University of Edinburgh, because we have the expertise in our team in workplace mental health. So I talk a lot about FIRST with a PH. That's the acronym for the scheme. So if you're interested, again, feel free to reach out to me. I can give you a bit more information on how it works and what is needed to apply. So I guess we've had a few introductions already, but if you're happy to have a chat, keen to hear if you've got any experience in evaluating networks. Any network doesn't need to be a mental health network, and also just thinking a bit about what the challenges could be of evaluating the Leeds Mindful Employer Network. If you have any ideas, please shout. Be really interested to hear your experience.
I'll go because I don't like silences.
I was just seeing who cracked.
Yeah, I don't have any experience of evaluating networks. I have worked with FIRST in the past in a former role. So in my former role, I was a principal leading the Choose You integrated smoking and healthy weight service for 3 local authority areas. So before that was kind of built, when it was just Stop Smoking, we did an evaluation with FIRST to look at post-COVID, the difference between kind of telephone support and in person. So we did something kind of similar. Haven't done it for a network, but it was a really interesting experience. And I imagine you'd have similar problems with a network to what we had, in that some of the outcomes, because it was preventative, weren't measured by kind of like somebody did smoke or didn't smoke. It was more about some of it was around preventing uptake, so it was really hard to capture that as an outcome. And I assume something around a network, particularly looking at mindfulness, would be similar. It's around preventing people from maybe becoming really unwell or going off work, and that's quite hard to measure if you don't have a specific, they were off sick or they weren't. They could be at work and just maybe have some different things required. So yeah, that's the only thing I can think that might be quite difficult to evaluate.
Yeah, measuring prevention is really hard, really hard. Good. Thank you. Thanks for sharing. And good to hear you were, or interesting to hear you were involved in a previous FIRST evaluation.
I didn't lead it at the time, but I was involved with the team, so I do value the work that FIRST do. I think it's really, really good.
Oh, thank you. Yeah, so I mean, yeah, measuring prevention hard. I'll touch upon a few other things. The thing that was really hard for us here is thinking about, you know, it's a network. There's over 800 businesses, organizations involved in that network. So, you know, again, that sort of, if you think about data, there's almost 800 different ways of collecting and presenting data. But I'll come to that in a second. If you know about FIRST, you probably know the evaluation timeline. It's pretty, for academia, that's pretty fast, 12 to 18 months. So this one was about 18 months, and this is sort of the timeline we go through. There's a bit of a quite a thorough scoping phase at the start. We call that evaluability assessment, but it's basically an in-depth sort of scoping phase. It takes a while to develop a protocol and get it approved, ethics, governance, things like that. Then move over to the actual evaluation that people often call the actual evaluation, which is data collection analysis, writing the final report, and also thinking about how do we actually share that knowledge that we've worked so hard to gain. So those, I'd like to talk about three sort of bits of this timeline today, which is the scoping, the protocol, and the knowledge mobilization. So what we do for scoping is we really start off by asking three questions, just very open, three questions, sometimes even in writing before we meet the sort of local authority. And that is, what information or evidence are you trying to generate and why? Who is the information for? So who's the intended audience? And how is the intended audience supposed to use it? Could be to inform a decision, could be to change practice, advocate to change policy, could be for recommissioning, all these things. So just to get a sense of what direction this evaluation could head in. And it was really interesting looking back at what it was in this case. So very early on, this was January 2025, what evidence are you trying to generate and why? The answer was to measure impact on health and workplace outcomes, especially staff wellbeing, absentee rates, turnover rates, impact on workplace culture and talent attraction, some information on return on investment, and understanding more about engagement rates so that the network could be improved. So how to improve engagement. Why do some people not engage? How could we overcome that? The audience, three different sort of audiences. One, local to Leeds, commissioners, elected members, policymakers, very interested in return on investment. But there was also some recognition that this is a really useful evaluation for employers in Leeds to help them understand how to get the best use of this network. And other public health teams, so thinking, I mean, we've got people here from across the UK, so thinking, you know, how could, if other councils were interested in setting up a network like this, what could they do, what could they think about? And then, yeah, it's primarily for future commissioning. I know that, you know, interventions need to be evaluated. In this case, I think it was every 2 years, so we would feed into that process. But also thinking about best practices. Leeds Mind especially were interested in that. How could this be improved? So this is the three questions. We didn't, and I'm going to explain exactly why we didn't answer all of them. But these were the three questions from the outset that would have been useful to answer. So thinking about that green box here, again, over to you guys. What could be the challenges of answering these particular questions, especially sort of return on investment and individual impact on health and workplace outcomes? Like, what could the challenges there be for evaluators? And I know, Donna, you weren't part of this process at the very start, so also happy for you to come in.
Yeah, I mean, I was going to come in on it actually, because I think we have this sometimes as an issue across a lot of public health evaluations, but specifically I foresee some of the challenges here being getting the baseline of information in the first instance. It's not something as commissioners of Leeds Mind we ever asked as part of becoming a network, a member, around, you know, what is their baseline sickness, what is their absence like in an organisation. And without that, it's very difficult to measure the impact of the network in terms of improvements on them. So I think that was really ambitious when I look at that now, knowing that, you know, I come into this team when this has been kind of developed halfway through. Looking at that, I think that's a really big ask. And it would be for me, it would be the data. We don't have the baseline data to be able to evaluate any of the impact, and I think that's common of a lot of public health evaluations.
I mean, it is a lot. It is a big ask, but it's also really good for us as evaluators to understand. You know, you start big and narrow down. Good. Any other reflections? I see someone, Laura, in the chat. You said people don't engage with an intervention, often also don't engage. Tell you exactly. Yeah, that's the point I'm going to bring up later. You often work with those who are already engaged. Yeah. Good. The impact on health and workplace outcomes. The key point we had there was we'd need to get the data from at least a subsection of those 800 network members. In practical terms, that would mean lots and lots of different data sharing agreements. Bearing in mind we only have about a year to do this evaluation. And also, you know, the data would look different in each organisation. Some might not even collect it. How would you attribute any changes in these metrics to the network, which is such a broad intervention? It's nothing specific with a specific time point, you know. So these are all thoughts that we had in our head when we first got the sort of very broad kind of scope of this evaluation. So what we do then, and there's a scoping phase, is we do workshops. So Laura, you might remember this from from working with PHIRST, but we call them evaluability assessment workshops. So we have stakeholders from the intervention, so this is from Leeds City Council. We had employers, we had people from Leeds Mind join us twice to discuss different points about this evaluation. So the first workshop was all about what is the Leeds Mindful Employer Network, who is involved, what does it aim to achieve, and what of these achievements, of these aims, what is most important to people. And we used that information to develop a logic model. Then the second workshop was much more about the evaluation. So what questions should we try and answer? What knowledge do you want to gain from this evaluation? And also thinking about who needs to hear about this and how do we best reach them? So a bit more about knowledge mobilization. So I'm going to chat briefly about logic models. Just keen to hear who's heard about them before, who's used them. What experience have you had?
I hadn't come across the term before until working with PHIRST, but I really like it. I thought the logic model was really insightful. I thought it really breaks it down and helps you to understand the bigger picture. So yeah, I thought that was really helpful.
What we found often is they are helpful, but there's some, I don't know, people in this room might disagree, but sometimes there's a bit of the intimidation, that they seem quite intimidating to make and come up with. So I just wanted to share in the next few slides a sort of overview of what we use the logic model for. Even, I mean, you know, we came up with it together, but what did we actually use it for? So as an intro, you know, what is a logic model? It's basically a way of breaking down an intervention into what it tries to achieve, what are the activities, and what do you then try and achieve through those activities. So I've got an example here, totally different topic area. This is not mental health in the workplace. This is an example on a walking intervention. So thinking about, you know, referring someone to some sort of intervention to increase walking. So what happens is you recruit and train walk leaders, you develop materials and resources for them. Then people refer to the walks and people attend the walks for about 12 weeks. And then if they're satisfied with the programme, attitudes and confidence might change to maintain walking. People actually start walking on their own, kind of from their own initiative without joining this programme. And then they maintain it over months or years, and there's long-term physical and mental health improvement. So often these sort of boxes have headings, inputs, actions. You think about outcomes in the short term, in the medium term, and in the long term. And what we then, this is what we did for the Leeds Mindful Employer Network as well, and I'll show you later what the logic model looked like for that. But what you can then do is sort of pick out what you actually want to evaluate from this. So you've got different boxes, different timelines. What is actually useful to evaluate? Would you like to evaluate if walking is maintained, or whether people initiate the walking, or if people are satisfied with the programme, or does the programme actually sort of work operationally? Are people referred to this programme, and do they attend for 12 weeks? So it really showcases what you could evaluate, and then you've also got lots of assumptions in there. So there's an assumption there that walking improves long-term physical and mental health. I mean, we could evaluate that, but there's a ton of literature that is very clear in pointing towards the fact that walking is good for health. So it would, it's probably not worth evaluating that point. So I've put a big sort of green wedge at the bottom of this slide, and that green wedge stands for something. Any ideas what that green wedge could stand for? And it increases throughout. So it's time, resources, and money. So the further along the logic model you want to go in terms of evaluation, the more time, resources, and money it will take. Thinking about, walking maintained over months or years, you'd have to wait for that time to pass to evaluate it, as an example. So just an overview of how we sort of operationalize logic models and how we sort of work with them for evaluations. So I'll show you the logic model we did for the Leeds Mindful Employer Network. It's got a few more boxes in this one. I won't talk about it in detail. Please don't feel like you need to read it. There's a lot on that slide. But this is part one of the logic model we made for the Leeds Mindful Employer Network based on those workshops and speaking to people. There's some assumptions that go with it, the geographical boundary, and some external factors that come into play, a mental health strategy, the post-pandemic context. So this basically is the logic model, and thinking again about that sort of identifying the time points and what we actually want to evaluate. Thinking about the green wedge. These are the sort of areas here. Again, you don't have to read it in great detail, but these are the three sort of boxes that we looked into as part of the evaluation. Again, no need to kind of look at the detail, but just as a concept of making a logic model and breaking down the steps and thinking, okay, what would actually be useful to evaluate and what can we do with our time, resources and money? And this is what we settled on for the Leeds Mindful Employer Network. Okay, so thinking about the protocol development, we've had input from network members. So it was really important to us to have a sort of steering group of employers who actually were part of the network, who knew what sort of approach to the evaluation would work, who could give us accurate local context, local insights. We're in Edinburgh. We don't know what the network's like, what Leeds is like. So we really needed that local voice. So what we had is a steering group of about 6 employers who were part of the network, and they kept us straight. So we met about 4 or 5 times during the year, and they had review a lot of our approach and materials. And we also had the workshops, regular check-ins, and we also had Lee join us as an embedded team member. Lee, I don't know if you want to talk a bit more about that role and what that meant for you.
So yeah, it was a really good opportunity as part of the evaluation to be an embedded team member within the PHIRST evaluation team. So that was me working alongside the researchers throughout the project and being a bridge between the evaluation team and the kind of vast membership and functionality of the Leeds Mindful Employer Network. So the role was much more broader than simply observing or coordinating the evaluation. I was involved from the early stages, so contributing to the evaluation assessments and helping researchers to understand the network, its aims and how it operates in practice, so that we could work out the best way to approach the evaluation and what we wanted to find out. Throughout the project, I attended regular meetings with the team at PHIRST and supported stakeholder engagement in the evaluation, helped to coordinate data collection activities and acted as that link between the researchers and the local employers and partners whose voices would bring the evaluation to life. Being embedded gave me the opportunity to see different stages of the evaluation process up close, which was so interesting. And whilst maintaining appropriate boundaries around independence, I was able to gain an insight into how the data was collected, how it was analysed and how it was interpreted, and how the research sort of moves from evidence to findings and recommendations. And another aspect of the role, which is hugely enjoyable, is supporting the public involvement, so the co-production and the knowledge mobilisation. So working alongside colleagues to think about how stakeholders could contribute to the evaluation, how learnings could be shared effectively, how findings could be translated into practical resources, events, changes, tools that would be useful for employers in the network. And I really valued seeing firsthand how a large-scale public health evaluation is designed and delivered. It gave me a much better understanding of that evaluation process, the importance of asking the right questions and the amount of thought, planning, evidence gathering that sits behind such a high quality evaluation. And I got a really good appreciation of how co-production is embedded throughout an evaluation process like this. So shaping the evaluation, involving stakeholders, interpreting findings, planning dissemination activities. There was an emphasis on bringing together different perspectives and forms of expertise throughout, which makes the whole thing translate into a much more digestible I think, finding in the end. And it reinforced for me that evaluations are strongest when they're done with people rather than just about them. And another important learning was around ethics. So although I wasn't analysing the data, I am reporting on it, and being part of that evaluation helped me to understand the ethical considerations that do sit at the heart of a good evaluation practice. Not just formal approvals and governance processes, but issues such as the consent, the confidentiality, respectful engagement with participants, and sort of that responsibility that comes with collecting and reporting people's experiences when we're talking about mental health at work for improvement purposes. And it also gave opportunities for professional development I wouldn't normally have access to through my day-to-day role. So the training, the learning from the researchers, about different disciplines, contributing to presentations and helping sharing that learning with wider audiences. So looking ahead, I'll be taking forward a stronger understanding of how evidence can support service development, as well as the importance of building evaluation and learning into projects from the outset and making that sort of co-produced activity with everyone that's sort of involved in a project and everyone who's impacted by it. And I think it's also strengthened my confidence in working collaboratively with researchers using evidence to inform decision making. So it's been a really valuable experience, one I'd recommend. It's helped me to develop new skills and perspective, and it's really shown me the value of bringing sort of the employers, practitioners, experts, researchers together, and how that collaboration can really ensure research is meaningful and useful in practice. I think that's about it, really.
Thanks, Lee. I mean, yeah, that was very thorough. Thanks for the positive feedback. Really appreciate it. And I mean, from our point of view, we couldn't have done the evaluation without it. The connections you have to network members, the local expertise, it was really great working together on this. And I would highly recommend that sort of approach if there's an external sort of evaluator coming in, and just, it really helped a lot of aspects of this evaluation. Good. That was an insight a bit more into the sort of collaboration aspect of this evaluation. I go back to how we actually narrowed down the questions we wanted to ask. So after the workshop, going from those 3 questions, that were very, as you said, Donna, quite ambitious, thinking about return on investment, thinking about impact on sickness absence rates, how we went from that big sort of brief. In the end, we narrow it down to what is on this slide. which is to understand the impact of the network and how it can be enhanced to improve engagement and sustainability. So that engagement aspect, we kept that one. Objectives was how network members translate the network into action. So in that logic model bit, that would have been quite far forward. So how does it actually work, the network? Not thinking about outcomes, but thinking about how it works. And then we looked at the perceived impact of the network on employers and employees. Perceived impact, because measuring actual impact with numbers, sickness absence rates, all the reasons we discussed earlier, very hard to do, especially in the time we had. And then third was make recommendations on program enhancements, engagement and sustainability. So thinking ahead, again, thinking about that, operationalizing the network. So that's what we settled down on. Interesting comparing it to the brief at the very start. We definitely focused on some aspects there, but we couldn't do everything. And we got to this through the workshops, through weekly check-ins, and through the 3 questions. The first one, this is what we did. There's lots of different ways you could have done it, but this is what we did. How network members translate the network into action, that involved a survey. Thinking about the perceived impact of the network on employers and employees, and also thinking about the recommendations, that involved interviews and focus groups, which we did with both more sort of employers, so more sort of HR professionals, senior leaders, but also employees. And for that, we had a sampling framework. We understood that Leeds City Council and Leeds Mind were very interested in hearing from a broad range of people, broad range of organisations. So in order to make sure we did that, we developed a bit of a framework to understand who to recruit. And in the end, the survey, we had 58 responses out of about 363, and we had 46 participants for the interviews and focus groups. So, we were very happy with the interviews and focus groups. We also got to speak to non-network members, which is always quite difficult to try and engage those who are not engaged, as we identified earlier. So we're very happy with that, and got lots of information from that. The survey is always difficult for people to answer a survey. So I think we aimed for about 60 to 100 responses, and we almost got there. It's difficult. Some reflections from this approach. Originally, the survey was aimed at 1 person per organisation, just to make sure that we don't get duplicates. Maybe that overcomplicated things. In the end, we opened it out a bit more and just decided to filter on our side. Possibly, actually, almost definitely, the survey was too long and complex. We've learned from that in the evaluation we're doing next time. We're actually going to do a live survey. So we go to an event and do a sort of Mentimeter approach where people can, do the questions while they're in the room as part of an event to get more interaction. We're very happy we managed to recruit non-member organisations. Very difficult to do, although the question in the back of our minds is, of course, are we just reaching the ones who are already engaged, even if they're non-network members? Very hard to reach the non-engaged. We have a short time frame. We've only got 12 to 18 months, so we understand we're probably also sticking to approaches that are tried and tested. Surveys, focus groups, they're all pretty bog standard evaluation tools. There's no sort of wacky social media analysis or anything like that, just because we have such a short amount of time. There's a question there. What, perceived impact versus impact, is there a difference there? Or should there be a difference? Should we highlight that it is perceived impact? Is it important to highlight? Or is the actual sort of, what would impact look like? Is that hard numbers? Or, so there's a question there that, we settled on perceived impact. We decided to call it perceived impact, but you could think about it in other ways. So just to highlight that there. And I have added a few slides here with more detail on our methods. I don't want to go through them because there's so many words on them. And they're quite detailed, but if you are interested, they're there for your reference. So there's one of the survey questions here, probably the main survey question, which is what kinds of activities initiatives, policies or practices has your organisation implemented as a result of the network. The task was to fill out this table. As you can imagine, many people did not want to fill out a really bulky, lengthy table, but we did get some good insights from those who did. Insights into the sampling framework. So this was a sampling framework for organisations. We also had one for employees, and some questions from the topic guides that we used for the focus groups. So have a look if you're interested, get in touch if you're interested on learning more. I'm always happy to answer questions on these, and also the reflections we had from these. So if you're interested in the full report, it is there. So the link, the blue hyperlink there should work for you, or there's a QR code as well. So we've talked about the scoping. We've talked about how we actually develop the protocol. The last area I'd like to touch on is knowledge mobilization. And the main point to highlight there is that, you know, a lot of time and resources goes into an evaluation, but whether that evaluation is used or not is not actually guaranteed. It's, you know, this is Michael Patton is someone who did a lot of work on evaluation use, and, you know, he said, you know, you can't just assume it will be used. It actually, you know, use must be planned for and facilitated. And there's lots and lots of different reasons why an evaluation might not be used. So they're called threats to utility. So some examples here in this text box, but the evaluation does not answer the questions that need answering. That's why we put so much emphasis on the scoping at the start. That's why we've got weekly check-ins. That's why we really try and answer questions that are useful. Evaluation is seen as unfair or biased or not credible, unbalanced data collection and reporting. There's low trust in the process, or the users don't understand findings, or the evaluation just isn't, you know, it doesn't fit the context and situation. We do the evaluation and then we make recommendations that are absolutely not achievable or realistic. So lots of reasons why an evaluation might not be used, mainly because it's seen as not applicable or not approved. And there is the chance that this evaluation everyone has worked on very hard just sits on a shelf. And that's what we want to really avoid. So there's two opportunities really for this evaluation, which is it makes a difference, it has an impact in Leeds, with Leeds Mind, with Leeds City Council, with the sort of primary evaluation users, or it could have an impact much wider, thinking about other council teams, national networks, other employers. So we're trying to really balance these two opportunities here. And that's where knowledge mobilization comes in. I always like to think of it as you're trying to reach the right people at the right time with the right information in the right format. And if these four things align, you're not guaranteed impact, but you're on a pretty good pathway. So this is a sort of visual diagram of knowledge mobilization. There's a worddy definition as well. So active collaboration with key stakeholders throughout, creating new insights and understanding about plans and findings, sharing and integrating knowledge together. And the ultimate aim is to change practice and policy and have real-world impact. So I've bolded a few key words there, especially the active collaboration, sharing and integrating, real-world impact. Again, thinking back to this sort of these two opportunities that there are and how we then try and address that in an evaluation. So the primary evaluation users, you know, we do that scoping, we do the 3 questions at the very start. We've got weekly check-ins. We've got Lee, who was an embedded team member and was part of the evaluation in real time. And, you know, there's I could do a whole different section on trying to get the report finalized, but thinking about who needs to review, at what time, how much time do we give them, putting in diary holds for them, having a Word version that people comment on, and putting it to a graphic designer. So very different, you know, it's a whole process in itself almost. And then thinking about wider evaluation use. So I've got a few webinars coming up one-to-one follow-ups, mailing lists, social media, and just very proactive outreach with people who might be interested. And a big part of knowledge mobilization is thinking about the framing and thinking about different outputs. And the aim is really just to make sure people can engage with the findings through different ways, whatever suits them best for their personality and their type of learning. So I've put examples here of what evaluations in the FIRST scheme have created as outputs. That's not an exhaustive list. The table continues. You can have a look at the sort of full table on the link above. But yeah, loads of different outputs that can be created from evaluations. And looking back to the 3 questions, the intended audience were commissioners, elected members, policymakers, but also employers and other public health teams. And the use was for recommissioning and also to identify best practices. So based on that, based on all of what I've said about knowledge mobilization, lots of conversations, thinking about the key audience, thinking about what the evaluation is trying to achieve, we settled on a few different outputs. So we've got the final report, we've also got an executive summary, which is a standalone document that can be sent. I think it's 4 pages. It can just be sent as a sort of hook into the full document. We're also working on a video at the moment, so that's being filmed the next day or next 2 weeks. And that video is mainly aimed at employers interested in joining the network or other councils interested in commissioning a network and just understanding more about what it is and what our evaluation found. There's an event for employers, thinking back to the 3 questions. From the very start, employers were a key group of people that were interested in this evaluation as our audience. And we've got lots of webinars as well coming up. One with the Health Foundation, one later on this year with the Mentally Healthier Council Network. Again, an opportunity to reach wider. So that's about it. I'll skip to the summary, which is, this is the evaluation timeline. We talked about the scoping, a bit more about logic models, and thinking about methods, and thinking about our reflections on the methods, and also a bit more on why evaluation use is not guaranteed and what you can sort of do in terms of knowledge mobilization to help with that. Again, full report if you are interested. So thank you very much for listening.